pulse oximeter is a medical device that indirectly monitors the oxygen saturation of a patient's blood. It is often attached to a medical monitor so staff can see a patient's oxygenation at all times. Most monitors also display the heart rate. Portable, battery-operated pulse oximeters are also available for home blood oxygen monitoring.
The pulse oximeter finger probe should be applied to a finger that is free of nail polish. Nail polish remover pads are often available near the pulse oximetry. Once the fingernail has been cleaned off and you can see the nail bed, you just seat the finger fully inside of the pulse oximetry unit and have the patient hold their finger still. Pretty soon you will have a waveform on the screen. It'll give you an oxygen saturation number and a pulse rate, which you can see up in the top right corner. There are other options in pulse oximetry probes depending on your needs. There are disposable ATSU, which is often used in the operating room or in the emergency room. They're applied the same way with adhesives, so you can see the finger strap there. And then you would plug that into the unit. And again, look to see that you have a good waveform. And it looks good. The other option is an ear probe, which is, here's a disposable ear probe. These can be used on children or people who have shunting extremities. You just place it on the ear lobe. And again, plug it into your console. And soon enough you'll have a waveform and an O2 set. Other placement options for the pulse oximetry are the toe, and in infants, on the penis of a baby boy. Pulse oximetry can be a late indicator of hypoxia, sometimes known as a lag monitor. It measures solely oxygenation and not ventilation, so it is not a complete measure of respiratory sufficiency. It is not a substitute for a blood gas because it does not give you a base deficit, carbon dioxide levels, blood pH, or bicarbonate concentration. It does not assess CO2, so it will not identify respiratory failure from retained CO2.
Factors that can cause a false negative pulse ox reading are nail polish, hypothermia, excessive movement, or intravenous dyes like methylene blue. Also, do not place the pulse ox on the same extremity as the blood pressure cuff. This will result in a falsely low reading. Factors that can cause a false positive or a high pulse ox reading are carbon monoxide poisoning or sickle cell anemia.
Hi, my name is Kinsley Scamaldo, and my group members are Bahar Naderi and Ethan Meyer behind the camera. We're going to talk about our objective today, which is to describe the physiological conditions in which false high or low readings may occur in pulse oximetry. We're going to start with external interference. Although this is not a physiological condition interfering with pulse ox readings, it is a normal factor to consider when doing pulse oximetry. External interference being any kind of motion artifact, if the patient is moving, if it's a child, as well as bright lights. Next, abnormal hemoglobin, this being any anemic patient, a heavy smoker, or carboxyhemoglobin, as in carbon dioxide poisoning when the carbon dioxide is locking up the oxygen, not allowing for offloading of the tissues.
Other factors that can cause low pulse ox readings are intravenous dyes like methylene blue and black, green, or blue nail polish interfere with the pulse ox readings, whereas red nail polish has not been found to interfere with them.
An important physiologic condition to consider when using pulse oximetry is the possibility of hemodilution. In patients that have experienced trauma or have hemorrhaged excessively and have had a lot of crystalloid solutions to replace that volume, their hemoglobin may be very dilute, so you may be getting a low reading even though hemoglobin is fully saturated. This also occurs in cases of cardiac bypass. When you go on pump, there's a significant amount of crystalloid dilution in the circulating blood volume. If you are receiving a reading on the pulse oximetry of less than 80%, the accuracy is significantly diminished, so don't count on the reading being very accurate if it's below 80%. Venous congestion, such that occurs in tricuspid regurgitation or in patients with fistulas in their extremities, can also cause false readings on pulse oximetry. Ultimately, the pulse oximetry device is just a tool to aid the clinician. The clinician is always the ultimate monitor. If you are experiencing a low pulse oximetry reading or a reading that doesn't make sense, a good plan of action is always to check the cable and to make sure that it's connected appropriately.